Hi everyone. So today we have Dr. Hayder, a healthcare professional and 25 years of experience in the field. He is the CEO and founder of Occucare Middle East. Dr. Hayder, welcome with us today.
Thank you.
I would like you to give your viewers an introduction about yourself.
Well, I am a healthcare professional. I graduated in 1999 as a physician. I moved to Dubai, then I found myself into management. So my line changed from seeing patients into management and gradually started building the knowledge and studying. I have master's degree in healthcare management from Ireland. I have PhD degree of healthcare management from Washington, D.C., Eton University. So I found myself in that field, started in Dubai, soon became somehow international. Mm-hmm. I started doing more services in other countries, helping. I identify as a healthcare strategist, healthcare planner. We are into resetting hospitals, improving operations, patient safety, planning for the governments, the best scenario, the best way to do things, helping to improve the patient journeys.
So what was the thought behind starting up Occucare Middle East?
That's interesting. It just hit my mind how we started it. This was in late 2009 when Operation Free Afghanistan started, or it was on the peak. We were trying to help some of our subcontractors in sense of moving patients, getting retreated in Dubai, changing the map, the patient journey for them. And we found out that there is a lack in the system. There is a gap where you don't have a facilitator to follow up, ease the patient's movement from Afghanistan to Gulf instead of Germany, instead of sending back to US, putting in new plans, new ideas. So this is where it started. Then they started finding more gaps. You know, whenever you have new operation, whenever you have new project, you will face challenges. Along the way, you move these challenges, you find the root of the problem, you do root case analysis, you make improvement, you will find a gap, you will fill it. So definitely, and basically, Occucare came to fill that gap. This is how it started. Then the gap, we were finding more gaps. And then we helped the NATO in their operations overseas. And then we thought that we have lacks or demands or problems in the operation of hospitals. And we thought we'll go to the hospital and improve that. And then we found lack of operations in certain areas, certain places, or certain countries. So we started to build new healthcare services. Then we found a lack in the healthcare performance of some of the, I'll say newbies or people who are joining so we thought that it's time to train them. Then we found a lack in the supply chain, then we entered. So basically Occucare came as not a company, it came as a healthcare solution, a full healthcare solution. And since 2009 till today, which is the last almost 14, 15 years, Occucare had stabilized their presence and helped too many of our partners to build and grow. And ultimately, it helped our patients as well.
So, doctor, what do you, what exactly you guys do when, you get to know that, this is the hospital which have, this thing lagging, and then how do you get inside that and you get into the processes and, make sure that it's running well now?
That's a great question. We say the first line of management is patient to realize that he's sick.
Correct.
So the same. The first line of solving a problem is to identify a problem. So either we identify the problems based on the data we receive from our clients, or our clients will identify a problem and come to us for a solution. Let's have an example without mentioning the name of the places. One of the hospitals is not achieving a proper financial balance, I'll say.
Okay.
I'll say that not breaking even, loss of resources, starting making, incurring losses or whatever. So they identify they have a financial problem. So we come, we identify the problems, we analyze the performance. Many times, for small tricks here and there, to recreate the balance, and the hospital will be either breaking even or making a profit. Second thing, the world is facing this problem that the people who are investing in healthcare are not healthcare at all. So we come with our expertise and know-how.
And bring in healthcare professionals around.
Yes, we run it for them.
Right.
I mean, they do the finances. We are their consultant, or we are their advisor, or we are their operator, or whatever. We ask them certain questions. We tailor fit something for them. Whether it's a hospital, it's a specialty hospital, it's a clinic, it's whatever. So simply, we are a healthcare solution. So you have any problem or concern or thoughts regarding the healthcare, and you call us to find you the solutions.
So what do you think, what is the biggest challenge that is being faced by medical professionals around?
Let's agree that running the hospital is one, or running a healthcare is one of the most difficult tasks in the world. Because simply we are dealing every day with the valet parking, with the plumber, with the carpenter, with the cleaner, food services, nurses, doctors, specialists, consultants, profs.
So I think that the right resources is the issue.
So you have to deal with everything.
Yeah.
Now the challenge is either you are a doctor who doesn't have a finance background, and the hospital finances is the key to manage a hospital.
Correct.
Or you are a CEO with a finance background, or you know about finance, but you don't have the medical knowledge.
Correct.
And here you will fail again.
So identification of the gap, you do gap analysis, and after that you find a solution and give the alternate solution for that.
Because we speak both languages. We speak finance and we speak medicine. We speak marketing and we speak quality. We speak patient safety and we speak HR. So here the mix and match. And of course, by the end of the day, it's not Hayder, it's not a person's job. It's a team of experts who has done it too many times in too many different countries, who are eligible and qualified to do that job in the best way.
So I'm curious to know, because I'm also a marketer, I just need to know that, when it comes to healthcare, what is the best technique used for marketing?
That's a tricky question because, let's agree that it's different schools. And let's agree that whatever I say is my experience, my opinion, and my mind, which you might or my other colleagues will disagree.
Right.
But for me, marketing a hospital is a definitely different line.
Exactly.
Because first of all, I'm not selling you a product. It's not a pen, it's not a mobile, it's nothing which I show you and tell you the specifications. You are selling a service.
Correct.
And you should be very cautious how to sell this service, because you are not a supermarket.
Right.
Cheap marketing, which is come and visit us, or telling you that I have 20% discount, it's not a product. Marketing a hospital or healthcare should be based on performance, results, and creating a trust and creating relation.
And I think so. Relation is something that needs to be there, but I think so. People just make a hospital very flashy, but the end of the day is that the people, the skilled people who are there, the relevant professional people are there, and I think so that really works out. So a professional should speak up, and that should be advertised. This is what my opinion says about marketing.
For my opinion is you should show people what you do.
Exactly.
You should tell people your achievements.
Correct.
You will build that relationship and bond.
Yeah.
Away from finances. I consider adding finance to the equation of marketing of a hospital is an insult for the doctor and the patient.
Correct.
Because it's beyond that. It's not money. When you come to healthcare, it's not money. Money will definitely come.
Yeah.
But this should not be the goal. This is why we always call for patient-centric, patient-centric, patient-centric.
I think so the entire healthcare system should work in this way. If we talk about marketing, that specifically it should not be at one focused that promoting it or making promotions. That doesn't work out. It is more of a skill set that needs to be addressed to.
Definitely.
Yeah.
And what caused that damage to healthcare always is a bad management.
Correct.
I always complained of this. The investors will invest millions. I mean, any project now for a hospital is a $30 million up to $100 million for the project. Mm-hmm. But when it comes to management, they don't invest as much. Putting in mind that any success of any project is the management. So you might invest 100 million and lose it because you did not invest 1 million in proper management.
Okay. So you give the entire roadmap to the investor that what needs to be done, or probably if just in case a hospital is being run or it's active, but they are not doing well and they are trying to shut down the business. So in that case scenario, how would you pick up things, because it was like a bad management, it was not running well due to many things in place.
The problem that they realize, all of them, and they will end in our offices asking for help, but they usually realize late.
Correct.
And this will put a burden. It will be double work for us to correct previous mistake, plan, and implement. If you start a hospital from the ground, you already put your plans and you implement them. But when you have these difficulties, you have to go through the process of cleaning, going back to zero, and building again, which is exhausting for both of us. Exhausting financially for the owners, though it's worth it, because in a couple of years, he will be on the right track again. And exhausted for our team, who has to do double work.
Correct. So, other than your work, how do you maintain your, work-life balance? And what is the advice that you give to people around for mental health?
Well, I'll say it's just to prioritize. I have my priorities. I put the family as a priority. And after the family, I put my work as a priority. And after that, I put my physical as a priority, because I believe that you should be good inside out. You should look good. It's not enough to be clever. You should be clever and presentable. And mental health is part of it. Once you prioritize, you will find a space for each and every of your priorities. I mean, I am proudly saying that within my priorities, I visit the psychologist once a month, just to make sure that I'm on track.
Yeah, this is the biggest misconception also, people don't go to psychologist.
It's part of the mental health.
Yeah, it's part of the mental health.
I train my body 6 times a week. I train my brain once or twice a month. Mm-hmm. I eat 4 meals to keep the shape. I sleep 8 hours so I can recharge my brain. I work for 8 hours to make sure that I'll have the income. I see my kids every day or every other day to keep that relationship. So it's all about priorities. You put your priorities and find a space for each and every.
And doctor, what is the advice that you are going to give to the young medical professionals around, how they should start up their career?
That's a great question. Since I have 2 of my children are becoming one of these soon, doctor and a dentist, so I always tell them it's not as important what to do. It's always important how good you do it.
Perfect.
I mean, if you are a doctor, you should aim to be the best.
Yeah.
If you are a nurse, you should aim to be the best nurse. If you are a driver, you aim to be the best driver. So, step at a time. And I always talk to them about patience. You know, they are still kids, they are very aggressive, thinking all the time, overthinking, pushing. So I tell them, just hold your horses, step at a time. Focus on what you have today. It's fine to plan for the future. But don't make these plans pushing you away from your path today.
I think so. It's more about being focused of what you're doing, and it should be something that should come, inside. Like, it's something that that will drive you to do that. So I think so that there should be something that do what you love to do.
Definitely.
rather than just stepping into something that you don't like.
And I always say flexibility and agility.
Yeah.
Because I made plans when I was young. I was thinking that I'll be the best cardiologist in the world. This will be my line. And within the time, I found myself drifting.
Right.
I drifted from being that physician, loves his stethoscope, to that person who is more interested in management, planning, strategies, setting things, putting plans, line,
But
quality.
that is again related to the field of healthcare only.
Yes.
Because that's where you have identified that
Yes,
this
but
is,
I drifted.
yeah.
I mean, I switched the stethoscope with a calculator. I
Okay.
switched my subscriptions and everything switched into a different area. But I was flexible and agile enough to adapt that.
Correct.
And I'm a person who believes that your thoughts, beliefs, plans can change. Your interests are changing.
Right.
I haven't seen myself in a gym, never. But I found myself there and it became an interest.
Correct.
So you should be ready to adopt new habits,
Right.
new plans, new lines.
But career-wise, do you think that switching the career so quickly is like a good thing?
It wasn't a quick switch. I mean, I had 2 years where I used to see patients and into management. I was very careful in shifting. I wanted to be 100% sure that I'm taking the right step.
Correct.
So I tried to keep the balance between two. It was exhausting for a year or two, but then I was certain that this is my path, yes.
Correct.
I enjoy it.
Doctor, one more question that I have in mind is there is a lot of technology advancement coming up, artificial intelligence, VR, IoT, all of these are coming up. Like, how would a hospital or a healthcare system would adapt to these things? What are your plans as Occucare Middle East, let's say after 10 years?
We are on that track now. We are on that path.
Okay.
We started using these technologies, introducing, advising, integrating, because simply we see that as a future. And I'm one of the believers that this will not take the human role,
Yeah.
because the medicine is a different thing. it's a human touch. It's an understanding. Yes, it is algorithmic now, but this algorithm needs to be operated, analyzed, understood by professionals. So I believe that these technologies will help. It will help to minimize medical mistakes, human errors, reminding us,
Definitely.
advising us, helping us. It will improve the diagnosis. It will improve the management and medication and all these parts. So it will be useful. And any hospital or any system which is not ready to adopt the artificial intelligence will definitely fall. It will be
Correct.
years and years back because this is moving so fast.
Correct.
And I mean, we are talking about virtual medicine now.
Yeah.
We are talking about seeing a patient in other countries, prescribing medications, following up. So it moves fast.
I've seen a lot of VR simulation as well around that. They put you up in a situation where you can do heart surgeries through VR. All of these things are as well being done in the market. So I'm 100% sure there would be a lot of things that would be coming in related to artificial intelligence and Internet of Things, and technology advancement is booming these
Yes,
days.
to help us to improve our skills.
Correct.
To help us to keep our patients, to
Correct.
help us not to take reckless decisions, to guide us, to remind us, because your brain cannot afford all the data you receive along the year. I mean, drugs interaction as an example, which we have thousands and thousands for drugs, and you cannot remember these thousands how will interact with the other thousands. So having that technology will support and help. And at the end of the day, if you are serious, if you are honest that you are patient-centric, you have to use this.
Correct. And doctor, what is the dark side of the healthcare industry, I would say?
Unfortunately, not all of us were honest to our Hippocratic oath, because it's somehow, somewhere, sometimes shifting to be more product, finance. It's losing the touch. And if I remember my plans and dreams when I was a student, and literally how will I graduate and help patients and doing things to help the community. And the first years of my trip in healthcare, where I used to be working for 14 or 16 hours and going home so tired but happy because I helped this and I helped that. So I think we are losing that. Part of it is the pharmaceutical company. Part of it is the owners who are not medical background. Some of it is the new life. It's all about money,
Correct.
finance. So we are losing that human touch.
That selflessness, I would say.
Unfortunately, yes.
Okay, so we have seen that you have been traveling and going to some remote areas as well. So what are the challenges that you face when you build that infrastructure in those remote areas where the hospital system or healthcare system is not available?
If you are talking about the challenges we faced 10 years ago, it's different than today. Because 10 years ago, I didn't have the virtual medicine.
Correct.
10 years ago, I didn't have the artificial intelligence. 10 years ago, I didn't have the capacity to transfer the images that fast. I couldn't train people in the remote areas.
Correct.
Now it's easier, but still, first you need the infrastructure, and we cannot find it there. Many times I need to build the infrastructure first. Second, I need to find the proper staff who can accommodate that, who can live in these areas. And these people should be very dedicated, because it's very difficult situations we are putting them in. You have to educate people. Unfortunately, you have to convince the governments there without insulting them that they need help. They don't have the expertise. So there are too many challenges, but the results are overwhelming. I mean, at the end of the day, you see these people treated, you'll see them happy, more healthy. It's worth it.
Correct. Thank you, Dr. Hayder. It was lovely meeting you, and thank you very much for joining us.
My pleasure. Thank you.